Good morning again. Okay, fess up. Have you ever looked at bad plastic surgery pictures online? Partly because of the shock value, but the other reason may be you're kind of scared that that could happen to you. So Dr. Goodkind is here from Fusion Medical Aesthetic Boutique in Brantford to help us avoid that Joan Rivers effect. Good morning to you and thank you for coming in.
Good morning. Thank you very much.
Her name always comes up, doesn't it? Especially
Yeah.
when it comes to facelifts.
It
Oh,
does.
I don't want to look like Joan Rivers.
Right.
But you say that does not have to be the case.
No, that should be the exception rather than the rule.
Let's look at her picture and let's talk about what, is it just pulled too tight? Like what is going on there?
Well, Joan Rivers technically was done fairly well. She's just done too much too often. With each successive facelift, your skin doesn't contour well, the skin texture isn't nice, so she's just had a little bit too much.
And speaking of too much, many say the same thing about Bruce Jenner. In fact, many say he's starting to look kind of like a woman.
Well, that's the rumor, but here's Bruce Jenner. They paid way too much attention to right under his neck, not enough to on either side of his neck, so look at how terrible and unnatural his neck looks.
Yeah, and he was such a handsome guy.
Yep.
Oh, all right, now this one, Mickey Rourke. You know, you look at his picture now, and that's actually not a bad picture of his after, because, you know, such a handsome, fresh-faced guy from the 80s, and now, my goodness.
He's had a huge succession of bad plastic surgical experience. I think the first was the facelift, and you can see they ended at his face. They didn't bother contouring below his jawline and into his neck, leaving a huge discrepancy and a very unnatural look. Natural is the key to plastic surgery.
So less probably is more. Let's talk about some good pictures. Now I look at this woman, she does not look pulled, plastic, she just looks fresh.
There's nothing wrong with having plastic surgery, obviously, but the key to it is to look natural and nice and soft, such that in this case, this woman could go out without makeup and look her best.
And there's another one that you brought in as well that's, again, very natural now. Okay, so I'm looking at her before. Is the top left the before?
All of them across the top are befores.
And
all
the bottom
ones
is after.
On the bottoms are afterwards. And again, she just looks fresh, nice, and soft.
She really does. And she looked pretty good before, too.
Yep.
All right, Kenny Rogers. You know, Kenny, we've loved him for years and years. On the left, that looks like Kenny. On the right, I'd almost say I don't even know who that is. What did he have done here?
Poor Kenny Rogers had a brow lift that we used to do in the 80s, and most plastic surgeons stopped doing that in the 80s. They brought his brows way up too high, and he also had his upper lids done, took out too much fat from his upper lids, leaving him this sort of cadaveric kind of scary look.
Yeah, and it doesn't look like him at all.
Not at all.
What a shame. Will that begin to droop with age?
It'll take quite a while. It'll take 15 years before his brows start to come back down again.
Let's look at a good version of that.
Okay.
Again, so this is the brow lift.
Here's a brow lift. Here's a brow lift
nice. Yeah.
combined with upper lid surgery. So again, it should look really nice and soft. Here, and you see in her pre-op picture, she has a horizontal brow. Women should have an arching brow that goes up higher towards their hairline and lower towards their nose.
It takes many years off her, doesn't it? I mean, again, all these people look great before, but if they can feel good about how they look after, that is the goal.
Right.
We want to fit in Wayne Newton.
Poor Wayne Newton.
Yeah.
Poor Wayne Newton. He, as most males, his brows are quite low.
Was that a brow lift?
No, what they did is they inappropriately operated on his upper lids. With his brows being so low, it pulled his brows down even lower, closing his eyes off. So now you can barely see his eyes. Really what he should have done is had a little Botox in his crow's feet, called it a day, he would have looked fabulous.
So go in there, have a really good discussion with a surgeon that you can trust, and you may go in saying, I want this, but you may say, no, what you really could do is this to get the result you want.
Right. I think it's my job to show what you bring to the table, or someone brings to the table, and what could be done nicely. The key in searching for a plastic surgeon is make sure you see a lot of before and after pictures so that you're on the same page with them as far as the look that you want to achieve.
So look at their work, make sure they're board certified, have a good discussion, and then come up together with a plan.
Right.
Dr. Goodkind, thank you so much. We love when you come in.
Thank you very much.
All right, we appreciate it. All right, 10 years after the Olympics in Greece.